Hello there. This is another video which is a continuation of macro level policies and psychological distress. In the last three videos, I've created awareness, I've shown substance abuse disorders, and I've also shown the macro economic policies that are likely to create stress among Kenyans and create anxiety and depression, or contribute or trigger schizophrenic episodes because of stress. In this video, I'm going to look at the soaring loan interest rate, the trap of debt bondage. And as I always say, this program comes under the video project of Ogewe Bereahinya, that knowledge is beyond strength. Knowledge is beyond strength, and that's why I call my foundation Beyond Knowledge Horizon, because we go beyond knowledge and apply it to real life experiences that people live. In this video, we are going to look at the effect of debt trap on psychological distress. To cope with rising costs, many Kenyans turn to loans, relying on formal banking institutions, microfinance ventures, or ubiquitous digital mobile lending apps. However, as the interest rates rise to combat inflation, commercial lending rates surge, turning these lifelines into financial traps. Maybe you have heard of people dying of suicide because of loans. You have seen women who have died from suicide because of microfinance loans, or have had their household goods auctions. You have seen relationships broken because the mobile digital lending apps contact all your contacts and tell them that you owe them money. This shaming brings down a person's identity. It causes them anxiety. It causes them distress, as all of your trusted friends are made aware that you don't pay loans or you live on loans. The psychological reality of debt bondage is incredibly heavy. Mobile apps often employ predatory collection practices, using automated systems to harass borrowers, spam their contact list, and publicly shame them to their friends, families, and employers, living under the constant shadow of unpayable debt, while facing public humiliation and aggressive blacklisting, creates an environment of intense, isolating shame. The toxic mix of shame, anxiety, and helplessness has driven a tragic number of Kenyans to suicide, providing a devastating illustration of how macroeconomic monetary policies can have fatal consequences for individual mental health. Removal of subsidies in education and health, the death of hope. For decades, public subsidies for education and healthcare served as vital safety net for ordinary Kenyans. They offered a path for upward mobility through schooling and protected households from bankruptcy due to medical emergencies. The systematic rollback and removal of these subsidies represent a severe blow to the public psyche. When public university fees surge and primary schools demand high levies, education transforms from a basic right into a luxury. Parents face the heartbreaking reality of having to pull bright, ambitious children out of school because they simply cannot afford to keep them there. Simultaneously, a defunded public health care system means that a single major illness can instantly ruin a family financially. This reality breeds a deep existential dread. It strips away hope for the future, locking generations into a cycle of poverty and leaving individuals feeling that they are just one medical emergency away from complete ruin. I'm sure you are seeing many WhatsApp groups where individuals are fundraising for their loved ones who are in hospital or who are at home so that they can take them to hospital. This is because the removal of subsidies have affected the welfare of many families. State violence, protests, and collective trauma. The psychological toll of macro-level stress is not confined to economic policies alone. It is also vividly apparent in the state's response to public dissent. When citizens take to the streets to protest these harsh realities, the state frequently responds with heavy-handed coercion and physical violence. The traumatic impact of civil unrest and protest are expression of collective frustration, a sign that a population has reached its limit. However, the experience of participating in or living near this protest is deeply traumatizing. The sounds of exploding tear gas canisters, the chaotic screams of fleeing crowds, the stinging air, and the sights of direct violence create an environment of active combat. For communities located in areas prone to protest, daily life becomes unpredictable and terrifying. Businesses must close, schools shut down, and residents find themselves trapped in their homes, inhaling tear gas, seeing through open windows. This environment creates a form of collective trauma, fracturing the shared peace of a neighborhood and replacing it with a tense, unstable atmosphere of fear. Mental scars of state killings and police brutality. When the state uses lethal force against unarmed protesters, bystanders, or youth in informal settlements, the psychological damage runs deep. Witnessing a neighbor, friend, or a child shot down by those sworn to protect them causes acute post-traumatic stress. For families of those killed, the grief is compounded by a profound sense of injustice. They are left to mourn under the shadow of a state apparatus that often denies responsibility, intimidates witnesses, and blocks independent investigation. This environment breeds a deep moral injury across the wider community. It shatters the foundational social contract between the citizen and the state. When the police are viewed not as protectors, but as an unpredictable occupying force, the community enters a state of chronic hypervigilance. Children grow up with deep systemic fear of authority, and adults carry a constant low-grade terror that they or loved ones would be the next victims of unprovoked state violence. A radical paradigm shift for mental health advocacy. A deep connection between macro-level policy and individual mental distress shows that our traditional approaches to mental health advocacy are no longer sufficient. If social workers, psychologists, psychiatrists, and advocates continue to focus entirely on micro-level coping mechanisms while ignoring macro-level injustice, they risk become agents of the status quo enforcement. We need a radical shift in how we approach mental health advocacy. Individual therapy, neurochemical regulation, family interventions, economic policy advocacy, labor protection, human rights activism. So we should combine the two of them, moving beyond the individual structural advocacy. Mental health professions must advocate their professional identities, must expand their professional identities to include structural advocacy. A clinician must realize that advocating for fair wages, protesting predatory taxes, and fighting against illegal market demolitions are just as critical to their clients' mental health as prescribing medication or teaching cognitive reframing techniques. This means mental health organizations must actively participate in policy debates. They need to present comprehensive psychological impact assessments to legislative bodies, demonstrating the human cost of proposed economic measures. When a government considers a new tax or an austerity plan, mental health experts should be there to testify on how these policies will drive up rates of depression, anxiety, and suicide across the nation. Starting with the vulnerable workers, traders, and farmers, advocates must form deep alliances with the groups bearing the brunt of macroeconomic stress. Labor unions and worker cooperatives, partnering with unions to provide mental health education while simultaneously supporting their fights for fair compensation, safe working conditions, and reasonable hours. Market Trader Association, studying with informal traders to resist unlawful evictions and market demolitions, framing the defense of these business spaces as crucial protection for community mental health. Smallholder farmers working with agricultural collectives to address the stress caused by high input costs and climate insecurity, helping to build community-led mutual aid networks. By studying with these groups, mental health advocates help transform personal despair into collective empowerment, decolonizing mental health frameworks. In many developing nations, including Kenya, the mainstream mental health framework remains deeply rooted in Western Eurocentric ideals of individualism. This approach assumes an independent individual with economic security and time to pursue personal self-actualization through private therapy. A macro-aware approach to mental health must intentionally move away from this limitation, embracing indigenous, community-centered models of healing and resilience in African context. This means drawing on philosophies like Ubuntu and profound understanding that I am because we are, and because we are, therefore I am. When an individual's mental peace is disrupted by economic hardship or state oppression, the solution is not to isolate them further in private therapy. Instead, we must bring them deeper into a supportive community network. Healing should be pursued through shared spaces of mutual aid, collective grief rituals, and organized community action against the forces causing the distress. A manifesto for collective healing and dignity. Mental Health Awareness Month must grow beyond its traditional boundaries. It can no longer just be a time for sharing clinical definitions, encouraging self-care routines, or discussing interpersonal relationships. While these elements matter, they are only a small part of the long picture. We must recognize that the mind is deeply connected to the world around it. The psychological well-being of a population is directly shaped by the economic, political, and social structures under which they live. As we look at the realities facing contemporary Kenya, the limitations of an exclusively individualistic psychological approach become trailblazingly clear. We cannot expect people to simply meditate away the anxiety or shrinking paycheck, or practice mindfulness to overcome the trauma watching their livelihood demolished by a state bulldozer. To focus only on the micro and meso levels in the face of such deep structural hardship is an evasion of professional and moral responsibility. For total well-being, we need to address interpersonal healing, economic dignity, and fair wages, that is, practice structural justice. We also need neurochemical stability, have universal safety nets as a strategy for structural justice, interpersonal harmony, we have a human rights protection. The realization calls for transformation, realization call for transformation in mental health advocacy. We must build an integrated movement that combines clinical empathy with a commitment to social justice. Social workers, psychiatrists, psychologists, and counselors must step out of the isolation of the clinic and enter into the public arena. They must raise their voices to advocate for the worker, the market trader, the small holder farmer, and the vulnerable household, challenging the policies that inflict so much unnecessary pain. Let us commit to a richer, braver vision of mental health awareness. Let us continue to support individual healing, heal family dynamics, and offer compassionate care for clinical conditions. But also, let us also find the courage to confront the macro-level structures that fracture our peace in the first place. True mental wellness is not about learning to quietly endure a broken system. It's about finding the collective strength to demand, build, and defend a world where everyone can live with dignity, security, and peace. So we have seen how we can work together to advocate for mental health clients by addressing the macro issues, which are indeed psychological stressors and which have largely been ignored. We may continue to recommend medication, but unless the stressors are also addressed, they will still continue to be triggers. I'm happy as your educator of Beyond Knowledge Horizon, Ugewe Bereahinya, explaining to you how macro policies contribute to psychological distress, how we need to decolonize, how we need to bring Ubuntu or Omodo in the healing process, how we need to create a manifesto for collective healing. For example, if you are a psychiatrist, you can identify among your clients and form them into groups to work together, like in beadwork, like in painting, like in creative writing, and all those things to help them release their fears, to help them energize, build their self-esteem so that they can be able to face the macro issues that face them daily. Thank you very much, and I'm happy to share with you more information about mental health, and I would also like to refer to you to the earlier videos that I had done on this channel, most of them which were in Gikoi on mental health and substance abuse, as well as gambling. This is my share of mental health awareness month. I'm happy this month is my birthday month, and as I celebrate my birthday, I'm happy to share with you my knowledge as a teacher, as an educator, as a mother, and as a grandmother who is concerned about the future generation, about future posterity. Thank you very much for listening to me. And if you have any questions or comments, send them on my YouTube channel and share it widely. Thank you very much.